guys, welcome back to the D&N Medical series. In today's video we'll be looking at meningitis. So what is meningitis? Meningitis is basically the inflammation of the membranes that surround and protect the brain and the spinal cord, and referred to these as the leptomeninges, and this include the pia mater as well as the subarachnoid. So what are some causes of meningitis? Now, meningitis can be caused from a bacterial infection, and this may be in your respiratory tract such as nose, right? And then it can spread via blood to the brain. It can also be a viral infection as well as fungal and parasitic infection. It can be medicine that causes it to be immunocompromised, or you can do procedures, especially in the area of the brain, which can introduce these organisms which can cause meningitis, right? There's also cancer, which can increase your chance of getting meningitis. So what organisms can cause meningitis? Now, if it's bacterial causes, it can be caused from Streptococcus pneumoniae, which is seen in most adults. It can be Neisseria meningitidis, and this is seen in countries where this is prevalent. If for kids, it can be Haemophilus influenzae or E. coli or even group B strep, and then you can have Listeria for immunocompromised older adults as well as children. So as mentioned before, it can also be caused from virus, parasitic, or fungal infection. Now for viruses, it can be enteroviruses as well as your herpes simplex viruses, but these are usually self-limiting and it goes away on its own. Alright, so what are some symptoms of meningitis? You can have fever, sleepiness, headache, light sensitivity, or photophobia, and this is also seen in migraines. However, in migraines you usually don't get fever, etc. Now you can also get vomiting, especially in kids. You can have joint pains, rash, and seizures, and in adults you can also get what we call neck stiffness. All right, so your neck feels very stiff. This can also be a sign of meningitis. So what would be the treatment for meningitis? Now, meningitis treatment is dependent on what is causing your meningitis. Remember, it can be from parasites, fungus, bacteria, and virus. So we'll have to take CSF fluid, and this is taken via lumbar puncture, and then you test it based on the glucose, the protein contents, etc. You will know what is causing the meningitis. So if it's a virus that is causing the infection, usually it's self-limited and most don't require treatment. If it's a bacterial causes, then you need your antibiotics, which would be specific to the organism that is causing it, because more than one organism can cause meningitis. For parasitic or fungal infection, then it would be an antifungal or antiparasitic drugs. So guys, if you're having any of these symptoms, please get it checked out by your doctor, because you at home won't know what's causing the meningitis, and in some persons it can actually lead to death if it's serious enough. All right, so please get treatment for it and see your doctor. All right, so that's it for this video. See you in the next one. Goodbye.